Good afternoon, everybody.
Good afternoon.
I just want to tell the press there'll be no questions after this session. I'm Tom Mark, Chairman of the Craven County Board of Commissioners. The Craven County COVID-19 Preparedness and Response Team continues to meet virtually to examine all aspects of county government and the services it provides its citizens to ensure preparedness for COVID-19. Steps are being taken to promote the health and well-being of Craven County residents and employees by examining how services are currently provided and identifying areas where extra prevention measures can be taken if needed. Our goal is to continue providing the highest level of county service we can in the most effective manner while complying with the guidelines established by the federal government and the state government. Our ultimate goal is to protect the health of our employees and citizens and maintain the continuity of our government operations. At this time, I'm going to turn this over to our health director to give you the guidelines and the information that he has. Thank you.
Thank you, Commissioner Moore. Good afternoon. I'm Scott Harrelson. I'm the Craven County Health Director, and I wanted to give a brief update about what's going on locally. I'm sure you've heard a lot about the virus itself in the national media. Here locally, we're at a point where we have had some tests submitted. Not all the testing is done through the health department. We do a portion. Also, our private offices have submitted tests as well. Still today, we have one confirmed case, and that individual was placed in isolation and close contacts in quarantine. So we feel like we've had pretty good response on that one case. And across the state, our peers are saying that there's really not been any evidence of community spread at this point. They can take all of the positive cases in North Carolina and trace them back to out-of-area travel. Okay. So what we're looking at is the travel restrictions and the social distancing that are being put in place should quell some of the surge. Contagion rate in this is every person that gets an infection will infect 2 to 3 other people. And I've also had several questions about contact tracing. We've used that term, but I wanted to kind of go into a little explanation of exactly what that involves. These are old epidemiology. Epidemiology is nothing more than the study of communicable disease in man. And this is right out of the CDC's playbook. Basically use a ring method to isolate. So once somebody feels like they have the symptoms, which is basically a fever and a cough, then they will go to their primary care provider. If we're the primary care provider, they come to the health department. And what would happen then is we would do a rapid flu test, which takes about 15 minutes. We would also do a swab for coronavirus as well. Now, if the rapid flu test comes back as positive, then we know we got a seasonal flu, we would discard the coronavirus swab. If it comes back negative, then we would test for coronavirus. And as the health department, we would submit to the state lab, state public health lab, and they are ramping up capacity. They're adding new shifts, and I think response time would probably be fairly quick with the new capacity added, maybe 24 to 48 hours. We received notification on whether something was positive. Now, when the private sector submits, they're also giving you guidance, because when you have that symptoms and a negative flu test, what happens to the individual is they're placed in isolation because they're symptomatic, and their close contacts, their family members, are placed in quarantine. So if cases progress, more and more people will wind up in quarantine. Now, the social distancing, we've seen implemented. Even later today with the restaurants going to take out and drive-through, things of that nature. The reason that makes a difference is on the back end of this, if you're doing a contact tracing, which means going back to that early onset of symptoms and finding out where somebody was and who they came in contact with, whose hand did they shake, where did they eat at, did they go to an event, and then you have to do the contact tracing. And if they go to an event with a lot of people at it, then that work gets exponentially harder to try to come to those close contacts, which again is 6 feet for about 10 minutes. There's really only 2 ways to catch this thing, is droplet spread or off of a contact surface, or maybe shaking someone's hand. That's why we keep going back to the disinfecting and the hand washing as a major way to quell this virus. So that's what contact tracing is all about, trying to get to those individuals, not a contact of a contact, but the primary contacts of somebody who is symptomatic. Now what happens if you're in quarantine and you pop up as symptomatic is we start that process for you. All of the contacts are primary contacts of the individual. What we have been working towards as a local medical community, we've worked with Carolina East and their physician practices, and CCHC as well here locally, to try to divvy up the workload from this point forward. And I think what you'll see is a combined effort with resources and staff to set aside some exam spaces for anybody who may be symptomatic that cannot simply do a drive-through, but they really need some office time. The sicker of those patients. And as far as the people who need a test and they're symptomatic, you have to be symptomatic to have the test. If you're not running a fever, then you're really not a candidate. Even if you think you may have run into somebody with coronavirus, because we got the 1 case here, but we're getting a lot of calls that seem to be contacts of contacts, really not adequate for testing. Right now, we have sent off 4 tests. 1 came back positive, 2 came back negative, and we're waiting on another. The other providers have sent out similar amounts of tests, and if one of them turns out to be positive, then we'll receive word at the health department, and our community disease staff will start to follow up in the isolation and the quarantine and the contact tracing.
Good afternoon, I'm Jack Veit. We appreciate you being here for our media briefing. Craven County is declaring a state of emergency in response to the novel coronavirus, COVID-19. This will be effective at 3 p.m. today, Tuesday, March 17th, 2020. Declaring a state of emergency means we are opening the door for federal and state resources and our ability to acquire them should we need them. This state of emergency does not include other restrictions at this time. Due to the ever-evolving changes with the virus, Craven County will continue to monitor and adjust this declaration as necessary. Declaring a state of emergency helps Craven County officials respond to and prevent further COVID-19 cases in Craven County. The state of emergency also helps speed up the supplies, allows for budget flexibility, and allows for the redirection of staff to the COVID-19 crisis. It also protects the consumers of this county from price gouging, which is an important part of our process. COVID-19 has been identified as a communicable disease, which can cause severe sickness in and death of infected individuals. In turn, COVID-19 has been declared a pandemic by national and international health agencies. The President of the United States and the Governor of North Carolina have both declared states of emergency in advance of Craven County. Additionally, federal, state, and local public health agencies have issued recommendations necessary to prevent or impede the spread of COVID-19 in an effort to protect the general population of the United States, the state of North Carolina, and Craven County. Yesterday, press release 4 came out from Craven County, which implemented additional protective measures for Craven County government and its employees, along with things that will help our citizens through this crisis. We took guidance from Executive Order 117, as many of you know, Executive Order 118, which just will be released at 5 o'clock today, which has different guidance. Of course, this information that we're providing you today was founded on information that was available to us this morning. We do still want to remind the public that there are certain things that you can do to reduce the risk of coronavirus. As our health director just said, washing your hands, maintaining proper social distancing, using hand sanitizer when appropriate, but knowing washing your hands is the most effective way. Several different changes in operations have happened for Craven County over the last 24 hours. We're heeding advice, as I mentioned earlier, from higher powers. One of those changes is our New Bern Riverfront Convention Center will cease all operations effective yesterday morning. We will not be having any points of congregation at that center until we feel that it's comfortable to do so. We've also stopped all organized activities at our Craven County Parks and Recreation facilities. While our parks may remain open, we do not feel like we should be the cause of an organization of folks against any prior guidance from other officials. Our senior meals program has been changed. We're no longer going to be hosting congregate meals, but yet serving meals remotely as hand-delivered routes. And lastly, we encourage the public to remain calm. We know that there's a lot of calamity out there. We know that this is something that can be very scary at times, and we ask that you return to a level of normalcy in your purchasing. We want to make sure that our supply chain can withstand and can catch back up. It's important for that to be in place. Right now, we still think it's okay to buy your normal quantity of goods that you would buy on a weekly basis. Let's allow that supply chain to take. We're really pleased today to have both the City of New Bern and the City of Havelock with us at this time. I'm going to turn over to the City of New Bern. Mayor Outlaw, Manager Stevens.
Good afternoon. I don't need to tell anybody how serious this situation is. The City of New Bern being one of the more high-density areas of the county, in conjunction with CDC, the county itself, and the governor's declaration, we have, as of 3 o'clock today, issued a declaration of emergency. With that in mind, as we continue daily for the next couple of weeks, if we see fit that we need to make compliance with respect to restaurants and grills and other social activities, we want to have that in place so that our staff can implement the policies that we need at this time. To give you a little more detail on that, at this time, the City Manager of the City of New Bern, Mark Stevens, is going to give you some information.
Thank you, Mayor. As you know, and I'm not going to try to repeat a lot of what Jack already mentioned, you know, COVID-19 is a very serious matter and health risk to our community. Our state of emergency aligns with the counties very much so, and the reasons that the county manager outlined as far as our funding abilities and our abilities as staff to be able to operate outside of normal protocols with regards to budgetary spending and actions that we take. We will be issuing that proclamation of the state of emergency effective at 3 p.m. Very much like the county has done, and I'm sure as City of Havelock is doing as well, we have modified our operations and activities that we're doing throughout the city. We find that it's imperative that the City of New Bern take the lead in setting an example of social distancing and doing our part of reducing the risk to our citizenry and minimizing the impact on local healthcare providers such as CCHC, Carolina East, and our health department. With cases growing in number throughout the state, the city is taking proactive measures to assist in flattening the curve and doing our part. All of our staff are reporting as normal. However, there are some things that we're doing as far as our normal business operations and our city facilities that we're changing. City Hall has been closed to the public, but we are still operating City Hall and staffing City Hall with normal operations. If people need to visit City Hall for some reason, obviously we're screening those reasons, and the number that they can reach out to request that is 252-636-4000. Meetings and boards of commissions, I would advise people to keep updated on our city website with regards to any of our city meetings and commissions that we have. A lot of those have been scheduled or postponed to a later date, especially during this 2-week period, which could potentially extend further than the 2 weeks at some point. We will be making decisions, if necessary, to extend those if those decisions are made at the federal and state levels. Public safety facilities. This is a very primary concern for us. Our citizens will expect us to continue to provide fire and police services when they're called. We have restricted all public access to our public safety facility for the reason being that if one of our individuals in the fire and police department are infected with that, we could potentially lose an entire shift, which obviously causes a very extensive problem for us internally in being able to provide fire and policing services. So therefore, if you need to reach 911, or if you need to reach police or fire and it's an emergency, as always, please call 911. We will respond. If it is non-emergency, please contact our non-emergency phone numbers at 633-2020, and that is our police department non-emergency number. If you need normal business operations with regards to fire services, please call our fire department at 639-2931. Our public utilities and utility business office, obviously it's important that we continue and have continuity of services with our public utilities department. Electric, water, sewer, everything will be operating as normal. Our staff are out there working, so that should not be a problem for any of our citizenry. Our utility business office, as far as receiving payments, they have closed the doors to the public as far as entry into the building. However, we're still processing payments and receiving payments at our drive-through windows. So people can still use their normal methods of mail-in. They can pay electronically, or they can come by our office and drive through and make their payments for any of their utility bills at that location. Parks and Recreation, our Parks and Recreation facilities are closed. West New Bern Recreation Center and our Parks and Rec admin building is closed to the public. The city parks will remain open during normal business hours. However, citizens are encouraged to maintain the social distancing and refrain from large group gatherings. Just like the county is, we are not going to allow organized parks and recreation activities and programs and special events at any of our facility, and those will be suspended until further notice. For those who still need cemetery services, we will continue to provide those requests, and all of those will be handled electronically unless in-person requests are needed. Please call 639-2904 for any cemetery requests or needs. Our building inspections department we have closed to the public as well. Those offices are located at 303 First Street. We advise folks that if they need permits or applications, we have set up a desk with all the necessary instructions in the foyer entering into our inspections department. Any applications can be filled out there or electronically and dropped off. We have some contact information that is located at that particular location. If you are in need of final permits and final inspections, we are doing those. Please contact our inspections department at 639-2942 or 639-2945. And any building and inspection related paperwork can be emailed to andersonj@newbernnc.gov, and we will process those as we do in normal business. To assist some of our restaurants and bars in downtown specifically, because most of our locations that are outside of downtown have their own parking and or curbside service. We are implementing some temporary modifications to downtown parking to accommodate for curbside pickup in those particular locations, given that the governor just announced that restaurants and bars will be closed effective at 5 p.m. to dine-in services. So therefore, we are enforcing some temporary modifications of the parking restrictions in downtown to allow for drive-up services for those particular businesses and restaurants so that they can continue to maintain and operate for curbside and pickup. These areas obviously in downtown will be designated with cones, and those spaces will be allowed for people to drive up. We ask that people who are looking to pick up in their downtown restaurants their orders, that they call ahead and ask specifically of the restaurants if their food orders are ready, and then at that point they can pick those up once they are completed in those drive-in areas. We just want to make sure and reiterate to the people to maintain their social distancing, to not buy into the mass hysteria at this point. As you heard the health director say, we're at one confirmed case here in New Bern. It doesn't mean that there's going to be more that could potentially come about, but it's time for us to exercise control and time for us to exercise the recommendations that our federal government and state governments are doing, and we as a city are standing beside of the county and the City of Havelock in our efforts to try to reduce the outbreak and the impacts of coronavirus here in Craven County. Thank you.
Hello, I'm Frank Bottorff, the manager for the City of Havelock. In coordination with Craven County and the City of New Bern, the City of Havelock is also declaring its local state of emergency as of 1500 today. The city has also implemented precautionary measures because of the virus. Those are available both online and at our city Facebook. Due to the changing nature of everything, please look at that on those sites daily for specific limitations that are going on. We encourage everybody to abide by all the social distancing protocols that are out there. The only way we're all going to get through this successfully and help save lives, recover, and regenerate the economic impact that this community is known for is by all of us pitching in together. So really, I think we can get through this if we all work on the same team and try to implement the recommendations that are already there. So from the City of Havelock and the Mayor of Havelock, thank you, and that's all.
First, I want to thank the City of New Bern and the City of Havelock and all the municipalities that have worked with us with their cooperation. Craven County is a strong county, and this is not the first time we have had to pull together to overcome significant challenges. During these trying times, your county government is working hard to prevent the spread of COVID-19 in Craven County. I ask that you follow the advice of the reputable federal and state agencies and remain calm and know that your county government is here for you. Craven County has proven to be resilient in the face of adversity, and this event is no different. And I want to thank the county staff headed by Jack Veit, our manager, and all the other county employees that have really put themselves on the front line. This ends our briefing. Thank you.